Hi there, this is Dr. Davis. Are you one of the unlucky people who suffer from irritable bowel syndrome, known as IBS? Are you tired of feeling this way? You're not alone. It's estimated that roughly 15 to 20% of Americans have IBS, and just like you, they've been told that they have to live with it, and there's no way to cure it. I'm sure it's a huge frustration getting rushed in and out of doctor visits and walking out with a new prescription and no answers. I share your frustration. I see and consult with patients every day that have been through exactly what you've been through. After seeing this video and others on the site, you'll be armed with the information and knowledge to help you make good decisions about your IBS. Drugs that treat the symptoms of IBS don't solve the underlying cause. The following is a list of the 7 things you must know about IBS. Number 1, it's unlikely that your primary care doctor will solve your IBS. If your doctor can't say that they've cured most of their IBS patients, it's time to see a real IBS specialist. While they may be good at other issues, IBS takes special training and special interest. I've had IBS myself and know full well the life effects it can have on a person. There's a big difference between an IBS specialist and any other doctor. An IBS specialist works only with IBS patients and does so every day. For more than 15 years, I've worked with IBS sufferers from all over the country. Most have seen several doctors before they decided to see a specialist. Some have even gone to famous clinics with outstanding reputations. But they weren't able to get well until they work with our office. Number 2, a gastroenterologist is not an IBS specialist. Gastroenterologists are doctors that perform endoscopies and colonoscopies, which are helpful in diagnosing other conditions like cancer, but not for solving IBS. Many doctors feel IBS is simply a psychological problem, and so antidepressants may be offered. This is so off the mark, considering that thousands of scientific articles are published each year showing what IBS is and what to do about it. No doctor can be an expert in everything, which is why I specialize in IBS. Our office is unique in that I have the expertise, knowledge, tools, and experience that has shown over and over to safely treat and cure IBS in most patients. Number 3, don't settle for less than a cure for your IBS. Many people manage their digestive symptoms with complex daily routines, altered plans, over-the-counter, and prescription medications. There's a real reason why there's an entire aisle of digestive aids in pharmacies and grocery stores. If this is your approach, you're missing out on a chance to deal with IBS at all. Managing IBS should not be confused with curing it. Curing your IBS will change your life, allow you to live it fully, and do things you've avoided or postponed for years. Number 4, there's no one-size-fits-all cure. IBS is complex and can be caused by hundreds of factors. There are many different cures that can be found online, including diets and products that claim to cure IBS. Most of these, unfortunately, don't work well for patients. Our expertise is helping you discover the root causes of your IBS so you can get proper treatment and move on with your life symptom-free. Number 5, you can get your life back. Digestive issues can be embarrassing and disruptive, can prevent you from going out when you want to, and keep you from experiencing the world. You deserve better than living as a prisoner to IBS. Number 6, you'll save money. You may not realize it, but your IBS is costly. You may be paying for supplements and medications that don't cure the problem. You may have paid co-pays and deductibles for doctor visits and tests, yet you still have IBS. You may also be missing out on earnings opportunities because of IBS. All this adds up. It may actually cost several hundred or thousands of dollars each year to manage IBS. Number 7, IBS is curable. You may have been told that there's no cure for IBS. This is simply not true, but comes from a lack of awareness about the potential to solve this problem. In fact, 20 years ago, IBS was considered a non-curable diagnosis of exclusion. But all that has changed. Our office has an unmatched success rate, and because I've cured my own IBS, I can tell you emphatically that IBS can be cured. Our track record proves it. If you or someone you care about has irritable bowel syndrome and other approaches haven't worked, come see us at our office and get a cure. It's time that you discovered what life would be like without those digestive problems. Just click the button saying that you'd like a free 15-minute phone consult, and we'll make that happen as soon as possible. Health is on the way.